Today I want to talk to you a little bit about diet and nutrition and its role in maintaining your health. Hi, I'm Dr. Michael Craig with the Whitefield Clinic of Dr. Spine in Bangalore, India. And a lot of patients come to me and ask me about pain in their body. They have pain in their neck, pain in their mid-back, pain in their low back, and they want me to heal this pain. The first issue is that as a doctor of chiropractic, I don't do the healing. Your body does the healing, and we just simply help the body to reestablish and maintain order and balance. That said, there are several things that you can do for yourself that can also bring about less pain, less stress, more relaxation, and more happiness in your life. First, let me review a little bit about what I talked about in another video having to do with pain and the causes of pain. Those three causes of pain, physical, chemical, or mental, emotional, can all result in this thing called inflammation. Inflammation is the body's reaction to these stressors, whether it be physical, chemical, or mental, emotional. And inflammation can cause an undue amount of pain in both the body, in the nervous system, and in the tissues themselves. For example, the cause of inflammation could be due to over-alkalinity of the body. And these symptoms can be measured by various presentations. For example, if someone has a lot of osteoarthritis in the neck or the back, that means bony growth, spurs, lipping, spurring, things like that. Osteoarthritis, which means weight-bearing arthritis, as opposed to something called rheumatoid, which goes into the joints. Now, osteoarthritis, bony growth in the spine, is an indication that there's less stomach acid, that the person is more alkaline in their digestive tract, particularly in the first part of the digestive tract. Stomach acid decreases as we get older, and so it's very important to increase that acidity in the stomach, and one of the best ways to do that is by taking apple cider vinegar. Apple cider vinegar is one of the best and easiest solutions to this problem. Simply take 2 tablespoons of apple cider vinegar in a glass of water, drink this 3 times a day before meals, and this problem should lessen considerably. Now, as far as another cause of nutritional deficiency, I want to use my own story as an example. For 30 years, I had headaches every week, usually twice a week or more, and I tried everything. I tried chiropractic, acupuncture, I changed my diet. All of these things would help, and I would notice some relief for a short while, but then the headaches would come back. It wasn't until I started doing some research on behalf of patients and realized that I was having a lot of the same symptoms that the patients were having, and I just poured myself into the research. Insulin resistance is the problem that I had, that I suffered from. Didn't realize I suffered from it for many, many years, and it wasn't until I changed my diet, got completely off of carbohydrates, increased proteins and good fat intake, and also started doing some intermittent fasting. It wasn't until I did these things that relief came on more or less a permanent basis. I'm almost 70 years old now, and I feel better than I did when I was 40. So that gives you an idea of how well these things can work for you. What I notice in India is that most people in India, most of the patients that I see in my clinic are either pre-diabetic or diabetic, and practically all of them have insulin resistance. Now, again, go see videos by Dr. Berg and others that talk about this in ways that you can understand and give you a complete background of how this happens. I won't go into this today, but I will give you the solution. The solution basically involves giving up all carbs, at least for a while. That means rice, that means bread products, that means sugar. You're going to have pain for a while until you cut down on your blood sugar and you get that under control. And I'm not talking about taking drugs, because drugs will mostly just balance out the lab results. The changes that I'm talking about will come about when you start changing your diet. And there's a couple of blood tests that I would recommend that you get. One of them is called a fasting insulin test. Fasting insulin test is a little different than fasting glucose test because it's a more accurate measure of how much insulin is in your body and what the results are that it's producing. Glucose is only one factor in diabetes, prediabetes, and in insulin resistance. The main thing is if you're getting too much insulin, the body doesn't know what to do with that. It combines with the sugar molecule and it goes into the liver, creating other problems in your body, and it has to show up in the fat cells, and you have weight gain, you have all sorts of fatigue, you have reduced thyroid, reduced adrenal function, and you just feel bad. Get a fasting insulin test. Ideally, the reading should be less than 3. Keto diet is one of the best ways to reduce insulin resistance, pre-diabetes, and even diabetes. Because diabetics can't handle sugar anyway, a keto diet is very powerful for them as well. So no matter what phase you are along the blood sugar level, you need to start taking care of this. Now, one thing I want to add to this discussion is that also in India, I've noticed, as well as in the US, I noticed that a lot of people are eating the wrong oils. Vegetable oils, seed oils, soybean oil, canola oil, things like that, nut oils. These oils are not really digestible, and they will cause harm because they've got too much what is called omega-6 in the body. Now, what you want to do is get your omega-3s up, and you can do that by doing an omega-3 profile to determine your level of omega-3. It needs to be above 10-12%. If it's below 8%, you're not getting enough. The best type of oils you can get would be virgin olive oil, coconut oil, and ghee or whole butter. That will ensure that you're getting enough omega-3s in your diet, and you're not getting too much of the other types of oils which contain lanolinic acid. Lanolinic acid is very harmful to your bloodstream, to your health, because it contributes more to inflammation. And as you recall, in the beginning of this discussion, we talked about inflammation as being one of the primary elements of pain in the body. So get the pain down, take action for yourself, start changing your diet. You will notice a huge difference. And look up some of these videos I mentioned on YouTube and get educated on this subject. Thanks. I'm Dr. Craig. I hope to see you in our clinic.